great pleasure to introduce our next speaker, Congressman Phil Gingrey, who's running for the Senate. So without further ado, Congressman Gingrey.
John, thank you for that long introduction. I deeply appreciate it. You know, the opportunity, of course, to talk to my fellow Republicans in Cherokee County, part of my congressional district. I want to thank Trevin, I want to thank Rick for giving me the opportunity. Obviously, following the governor is no easy task. Clearly, as you listen to him, you know we have a governor of great intellect, but maybe even more important, of great character. And I'm sure you all feel the same way that I do. I think most people in Cherokee County, I hope so, know pretty much who I am, and I've represented Cherokee County in the past, but that was back when I was a member of the Georgia Senate for a couple of terms, 4 years, that I had the lower third, I guess, of Cherokee County, the Town Lake area. I believe the population has increased from 100,000 to about 220,000 in that period of time. So surely there are some people here that may not know too much about me. I have had Cherokee County now in the 11th Congressional District just for a little bit over a year. And of course now running for the United States Senate based on Saxby's decision, surprise decision on my part over a year ago. Look, I want you to know I'm a native Georgian. I was born in Georgia, in Augusta. I was raised there. I went to Georgia Tech. I love the Bulldogs, by the way. I went from Georgia Tech as a co-op student back home to Augusta. I got a medical degree. I became a physician. I returned to Atlanta and I interned for a year at Grady Memorial Hospital. The best year of my life, the hardest year physically as far as workload, but I met this beautiful Delta flight attendant from Noonan, Georgia, also a native Georgian, named Billy Ayers. After that year, we married. We have been married now almost 44 years. We have 4 adult children and 13 grandchildren. The best part of that is they all live in Georgia, and I think they're always going to live in Georgia and pretty close to us in our home with Marietta in Cobb County. I set up my medical practice there when I finally completed all of my training. I'm an OBGYN physician. I practiced 26 years. I delivered over 5,200 babies during that period of time, all right there around Cobb County and the surrounding counties. I'm a proud pro-life OBGYN. Also proud that some of those babies I delivered are going to be voting in this election cycle, and hopefully they better be voting for Phil Gingrey. But, you know, I love being a doctor. I still, one day a month, yesterday was the day, I do a half a day at the Good Samaritan Health Clinic over in Smyrna. It brings me great joy. I keep that active medical license alongside of my lifetime membership of the NRA and permit to carry. But I will always be a physician. I was a physician when I was on the Marietta City School Board for a term. I was a physician when I was in the Georgia Senate for 2 terms, 4 years. I'm a physician now as a member of Congress in my 12th year. And believe me, when I get to the Senate, the United States Senate, I will continue to be a physician. We have had many debates, as you know. We're getting pretty close, within 5 weeks of the Republican primary. And I think we've had 8 or 9 debates. And some of my opponents, all good people, have tried to paint those of us who are members of Congress or who have been elected to some of these positions, whether it's local, state, or national, as career politicians. Folks, let me tell you, and I think you know this, I am not a career politician. If you count up all those years that I just related to you, you come to about 30, including the time that I spent in training. 30 years as a practicing physician makes me a professional doctor. It does not make me a professional politician. The 12 years, almost 12 years now that I've been in the House of Representatives, the school board, was part-time, the state senate was part-time. Yes, I am a full-time public servant now, but I think it's important for you as you go to the polls on May the 20th, again probably on July the 22nd, and certainly in November, to think about that, to think about, what the candidates have done with their lives. What is the totality of their experience? What is their maturity level? What is it that's really, truly motivating them? As the Bible says, where your treasure is, that's where your heart also is. And I think it's very important for each and every voter to think about that. Now, I realize as we go across the state, we go to the Republican Party breakfasts, and we're talking about the loyalists, the activists, the grassroots, people that really do the work. Nathan kind of jokingly said there were maybe only 6 people here that weren't either elected officials or running to be an elected official. I will take it a step further. In all probability, as we go around the state and speak, most of the people in attendance have already made up their mind who they want to vote for. And I understand that. I clearly understand that. Is it based on prior relationships, schoolmates, children in the same at the same ballpark on Saturday afternoons, likability, fraternity brothers or sorority sisters in college? All of these things are important. They're very important. But if Phil Gingrey is not your #1 choice, and somebody else is, because I'd like to assume that I've got a lot of #1 choices in this room this morning. But only 2 of us are going to get into this runoff out of 7. And you've got 7, I think, decent people. And at least 5 of which have a chance to be the 2 that go on to the July the 22nd runoff. The other 2, not as much of a chance, but that's not because their character's not good or they don't have good ideas. That's more because of a lack of money and a lack of name recognition. You know how that works. But if I, as an example, am not your first choice, you need to really think hard and clear about who, if your guy or gal is not in the runoff, who is it you would want to represent you of the remaining candidates? Because it's going to come down to that. It's exactly what it's going to come down to. I have not changed, as I say, in regard to being a professional physician. I will never change that. I will always be a doctor as I serve in the Senate. And I'll tell you something else. I'm not going to change my values. Nathan talked about this a little bit, about the importance of local control. There's one national government. There are 87,000 subnational governments. Whether we're talking about the states, the counties, the cities, the towns, the school boards, or these special boards or ports or whatever that are created for just one purpose. And you look at federalism and the way the country is supposed to work, and you think that we the people have the power and should continue to have the power. But if you look at the Constitution, and I think I have one somewhere in my pocket, I try to keep it with me, and if I ask people, went around the room and said, well, what's your favorite Bill of Rights? The 10th Amendment, the powers not delegated to the United States by the Constitution, nor prohibited by it to the states, are reserved to the states respectively or to the people. That's my favorite amendment. But what is killing us is Article 1, the enumerated powers, the Article 6 in the Supremacy Clause that says the federal Constitution, federal law trumps state law, the 14th Amendment, equal protection. This is what's killed us, because what the federal government is doing is they're passing laws to say that, well, these enumerated powers need certain law. You think about the Commerce Clause and that sort of thing. And slowly but surely, the federal government has taken away more and more power from the state. And every time they do this, there's strings attached. We let them do that, and those strings turn into ropes, and those ropes are choking us. And it is absolutely time. It is absolutely time to have men and women in the House and Senate that have a little backbone, that are willing to stand up strong on the principles of that 10th Amendment. But we haven't done that, so we're somewhat responsible, aren't we? And I think what we need, as I say, is men and women that have a little backbone, that will stand strong, that won't do things like, as an example, vote on a parliamentary procedure to allow cloture to occur, and then turn around on the final vote and vote against the bill. And I'm talking about men and women in the minority in the Senate. I'm talking about situations that have occurred in the last 2 years. For somebody to say that, well, you know, we're going to go ahead and vote with the Democrats and give them the 6 votes they need, 5-6 votes they need to get that 60 majority and bring a bill to the floor, and then turn around and vote against it, knowing that it only takes 51 votes to pass. That's the kind of thing that I'm sure I'm thoroughly disgusted with. And it's much worse in the Senate than it is in the House. So I want to stand strong. I want to be that backbone that eliminates this scoliosis that's been going on in the United States Senate for far too long on our side of the aisle. On our side of the aisle. And that's what I'll do. You know, I was thinking as we got started, and Trevon mentioned that Rick just went through a little illness, and I know a little bit about that kind of condition. And it is very, very important for Rick's health that his blood doesn't get too thick and that his blood doesn't get too thin. And also that he doesn't sit there and cross his legs. I've been watching him. He hasn't done that yet this morning. But you know what? It'd be a lot safer for his blood to be a little bit too thick than a little bit too thin. And I guarantee you his doctors would agree with me. And there's an analogy there. There's an analogy there in regard to how we conduct ourselves politically and what we stand for. And you want a member representing you in the United States Senate whose blood is a little on the thick side. You darn sure don't want somebody whose blood is a little bit on the thin side. Now, I've heard a lot of candidates over the last couple of weeks announce this endorsement and that endorsement and maybe a list of endorsements. Some of these people we've heard of, some of them are the famous newscasters or actors or whatever, and they're good people, and they've helped our cause, and I respect it, and I watch them on television, believe me. But when you cut right down to the chase, can somebody in Alaska see Georgia from their back porch? They might be able to see Russia. Can somebody from Chicago know that Phil Gingrey was voted the #1 conservative by National Journal 2 years in a row? No. Only you know. Only the 10 million people in this great state of Georgia really, really know. You know I live here, I was born here, I was raised here, I'm a physician, I've served. I served after my medical career, not before. And you know where my heart is. So the only endorsement that I care about, really, not that I wouldn't accept those other endorsements, The only endorsement that really matters to me is your endorsement. On May the 20th, on July the 22nd, and finally on November the 4th. Now, as I conclude, and Rick, Trevor, if there's any time for questions, I'll be glad to take a question or two, but I want you to know that what I have done is a pretty drastic thing. I have made a pledge to the people of Georgia that I will repeal Obamacare in my first term, or I'll come home. I'll get out of the way. I've had people come up to me and say, Phil, why are you putting yourself in that kind of a box? You're not going to be able to do that. I'm not going to be able to do that with Harry Reid as a majority leader. I'm not going to be able to do that with Hillary Clinton as the 45th president. So this election has got to be the most important election in our lifetimes. It is for me. And not just because I'm running for the United States Senate from Georgia and I want to win that seat for us. But nothing is more important than taking back control of the Senate, getting rid of Harry Reid, teeing it up then for whomever is our Republican nominee for president 2016, making darn sure the next president is not Hillary Clinton or any Democrat. And when we do that, I'll have 4 years left on a 6-year term. If I can't get the job done in that period of time, I should come home. A lot of candidates will make term limit pledges. A lot of people feel like that's very appropriate, that we have term limit pledges. But this is something that has accountability in it. If I say I'm going to limit myself to 2 terms, but I don't tell you what I'm going to do, I don't promise you what I'm going to do, what's that worth? I can be up there as a potted plant, living comfortably, going on Codels, enjoying whatever perks there are left in the halls of Congress. But that's not what you want. You want somebody that is your voice, and is your voice every time, and listens to you, and pays attention to you. So as we approach this critical date on May 20th, I ask you for your support. I deserve your support because I worked hard. I'm not a professional politician. What I want to do is in here. I'm not questioning my opponents and what's in their heart, but I know what's in my heart. And I want y'all to know that too. And I want you to know that I'll never disappoint you. I'll never embarrass you. I'll never let you down. Vote Phil Gingrey. God bless you, and thank you for the opportunity.
Thank you. I'm Robert Chambers. I'm with the Highway 20 Coalition. We're concerned about what could possibly be one of the largest, most disruptive projects to come through Cherokee County in 30 years, the reconfiguration of Highway 20. And I don't intend to blindside you if you haven't thought about this project, but GDOT says that fixing the existing road will meet or exceed all of the transportation needs through the end of their study period. The question is, and I like that you referenced the 10th Bill of Rights, will you support us in maintaining local control of transportation decisions that affect our lives and protect the beauty of our county, and keeping 20 on 20? GDOT says that meets all the needs, and not supporting the construction of a new multi-lane freeway through our counties. Your support will be critical because 80% of this money will come from the federal government. And I would also like if Bob would be kind enough in his time to address the issue. Thank you very much.
Well, the response to that question is absolutely, I will support you. I know there are a lot of elected officials at the county and city level here this morning, and their opinion is of paramount importance. But I definitely will support you because I firmly believe in local control. I've been working ever since I've been in Congress to try to get this 411 connector for Rome, Floyd County, and Bartow County to I-75, and we're about there. I've been working tirelessly to make sure that the President does his fair share in regard to the SHEP project, the deepening of the Port of Savannah. We've got the money, the governor's raised the money. They won't even let us start spending our own money on that project. That's why, you know, we have got to take back control of our country so that we can do what we know needs to be done at the local level. But you have absolutely have my assurance that I'll work with you on that.
Congressman Gingrey, it's great to see you this morning. Senator Grassley out of Iowa put together a letter calling for members of the Senate to support an initiative to defund the Common Core curriculum standards. I was wondering if you would comment on, would you support the defunding and withdrawal of Common Core?
You know, the simple answer is yes. Let me elaborate just a little bit. I told you that my public service part of my life, other than I guess I was class president in high school one time, but it was serving on the local school board, Marietta City School Board. All my kids went to school there. Great school, great district, very diversified. The people in Marietta, about 45,000 of them, elected 7 of us to represent them on the Marietta City School Board. We went out and campaigned and knocked on doors, and you know, I think it cost me $7,000 that election. But I know that I made promises to them. And promises made are promises kept. And I want to tell you that I absolutely would listen if I were back on the school board at any level to the people that know what they want for their children. Now, at the same time, I would encourage them. Georgia needs an educated workforce. Well, we're all extremely proud of Georgia. It's great geographically. Cherokee County is beautiful. You get into the Piedmont region or the coastal plains or up in the Appalachia Plateau. You couldn't have a more beautiful state. 120 miles of coastline. This is the best place in the world to live. No wonder nobody wants to leave. But you just want to make sure that we have an educated workforce, and I would say that we ought to do everything in our power. If I were back on the school board, I would want to make sure the curriculum was strong, not weakened, not dumbed down, that it was a very strong curriculum, but it was what the parents in my ward, my district, my precinct, my school board, what they want. If the people of Georgia decide that they don't want an educated workforce, then that's their decision to make. I think that would be a bad decision. But I don't want the federal government to come along and tell me, and especially in the social studies arena, and have textbooks and things that we, the people of Georgia, absolutely do not agree with in regard to faith and family and principles. So I am with you 100% on that. My answer is yes. I elaborated probably a little bit too long. If there's time for another question, I'll be glad to take one.
Got one more
All
question.
right. Carol.
Yes. Thank you. Good morning. We've been fighting very hard to oppose Obamacare in this state, as you well know. We had 37,283 signatures calling for the repeal of Obamacare in our state and in our nation. And I know that when you get up there again, we would like your help with an initiative. This coming week, we will be submitting to every candidate for higher office and for state office a request to support our coming initiative in this legislative session, which is to call for our national representatives to initiate a lawsuit to overturn the decision of Sebelius versus NFIB. We'd like your comment on that.
Well, I'm with you 100% on that. I want you to know, and you do know, that I told you about the pledge that I've made. I don't think any of my opponents in the Republican primary have joined me in making that pledge. I invite them to. But this is exactly what you're asking. You want some skin in the game. and you want some ink on paper to back it up, just like no new taxes. And if you make a pledge, you keep a pledge. You don't wiggle off the hook and try to find out some way to say, well, I really didn't mean that. I have voted for the repeal of Obamacare either in total or in part over 40 times. Over 40 times. Now, there are men and women in the House of Representatives, in our party, in the Senate as well as the House, but I hear occasionally some of my best friends, most conservative members that I caucus with, say, well, don't vote for that, don't vote for repealing this section or that section, because you don't want to make it better. You don't want to make it more acceptable. The only option is to complete repeal. I think we've voted for that on 5 different... I think we voted on that on 5 different occasions when it passed the House, and of course went to Harry Reid and just sits there. And so, you know, that old age problem of controlling 1/2 of 1/3 of the federal government is a numbers problem. And that's why I said for me to complete my pledge to you, we have to take over the Senate and get +6, hopefully +10, and whomever we decide to lead us as our majority leader in the Senate, and then win the presidency in 2016. So believe me, I'm for total and complete repeal. But as an example, let me just take one section or two. If we could had an opportunity to get rid of the iPad section, Independent Payment Advisory Board, this group of 15 appointed bureaucrats by, well, it was Kathleen Sebelius, but thank God now it's going to be somebody else. But those bureaucrats haven't been appointed yet. But if they, and when they are, and if they're not, the secretary herself could make these decisions on cuts to reimbursement to our providers, particularly our primary care physicians who take care of Medicare patients. And without them, we can't survive. So it's a life or death issue. So if I had an opportunity to vote on repeal successfully of that iPad section, I think you would want me to vote to repeal it. If I had an opportunity to get rid of the 2.3% tax on medical devices, which are, that in itself is driving jobs offshore and killing our economy, you would probably want me to vote for that, just like you wanted me to vote for repeal that 1099 issue, that $600 issue that we did successfully repeal. So, you know, it's a question of, you know, we're not trying to make it better. We're trying to relieve suffering of the American people until we have the votes that we can completely get rid of this monstrosity. It is, like Senator Hatch said, in my opinion, the worst piece of legislation that's ever been passed in the history of this country. So I'll give every bit of energy that I've got to get rid of it, to strike that sucker dead. Thank you very much. I appreciate that.